2:05. I think that's all the housekeeping. We're going to turn it over to John. And then the next voice you will hear will be Dr. Monica Parker. She's an associate professor of neurology here in our Goizetta Alzheimer's Disease Research Center, and she leads our outreach recruitment and education core. All right. So, John, take us away, get us moving, and then you'll hear from Dr. Parker, who will introduce our speaker for today. Thank you for joining us.
Welcome, welcome, welcome to the Emory Alzheimer's Disease Research Center. Today, I need to see if you can have some weights, you can have some canned goods, or anything around the house for resistance, because we're going to do some body sculpting, some abs, and a little bit of cardio today. So go get whatever you need right now. In 5 seconds, we're going to get started. And if you don't have any weights, use your own body weight and contract and release. All right? In 5, 4, 3, 2, and 1. Weights. Elbows up. Here we go. Nice and smooth. Chest up, chin up. Good. Rest. Watch my form. Elbows out. Rest. Good job. Here we go. Hands out. Squeeze, 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 squeeze. Good. Elbows up. Press. 3, 4, 5, 6. Good job. Let's get these biceps. 6. Hammer. Ready? Go. 6. Great job. Over. In. 3, 4, 5, 6. Good job. Let's cross it. Now man, that waistline in. Let's go. 5, 6. Let's go up at an angle. And go. Turn that waist. 3, 6. Great job. Elbow up. Press. 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 Good job. Here we go. Elbow up. And press. Press. Come on. Press. Press. And press. Good job. In front. Chin up, chest up, and 3, 4, 5, 6. Hands out, angle. 2, 3, 4. We gotta tighten it up. 6. Good job. Here. 2, 3, and real contract them. Here we go. Lean back, hands out, and 1, 2, 3, 4, 5, 6. Good. Switch. 1, 2, 3, 4, 5, 6. Right leg. Here we go. 1, 2, 3, 4, 5, 6. Here we go. 1, 2. We getting those outer obliques. 6. Feet together and 6. Next one, knees up. 6. Good. I want to stretch that lower back because it's a part of the core. I'm gonna tilt. 1, 2, 3, 4, 5, 6. Switch and 1, 2, 3, 4, 5, and 6. Great job, great job. We took our time and body scope today, but next week we're gonna do high cardio. So you get ready and make sure you do something for your temple every day. I'm John Lewis, and see you later. Bye.
Thank you, John. Everybody loves to work out with John, and thank you to John for joining us every week and making himself available not only to us here for Brain Talk Live, but to our different organizations in the community that love to exercise and work out with John. I know on behalf of many of our viewers, he has been to Conyers, he's been to Washington, D.C. to do exactly for other people what he does for us. So today, in keeping with fitness of the brain and doing things that we need to do, I want to introduce our speaker for the day. Our speaker today is Dr. Allison Reiss. She's an internal medicine doctor at New York University, Langone in Long Island, New York. And one of her areas of research is inflammation and lipid metabolism or cholesterol and its role in brain disorders and brain dysfunction. So she's done a lot of research. She has a lot of articles that I'm happy to sift through at some point in time. But this time I'd like to bring to you Dr. Allison Reiss, who again is a specialist in inflammatory processes, neuroinflammation, and metabolic disorders and their effect on cognition and sane. Dr. Allison.
Hi, Monica. Hi, everybody from rainy, windy Mineola, Long Island, New York. It's so good to talk to all of you. I was in Atlanta once a few years ago, and I just loved it. And I hope I get to go back because it was a great place to visit and a wonderful place to see. And I want to thank you all for joining me today. I'm going to try to give you some good, solid kind of common sense information about the brain and brain health and dementia, and how we can avoid that. I'm going to share my screen with you and start talking to you about healthy strategies for aging well and for brain aging. So we start with, what does it mean to age well? So we all have our own personal feelings about that. But to me, it's not that you live longer, but you live healthy longer. You are older, but you are not out of society. You are participating fully. You want to prioritize mental, physical, and emotional well-being and have a quality of life. Be independent, be living on your own, be mentally sharp. to me and to I think a lot of us, that's what aging well is. We don't want to be just sitting in a chair and not being out in the world. So that's what we aim for. So are you doing all you can to age with good health? So what I want to talk about today is a little bit about brain aging and Alzheimer's disease. The brain-heart connection, which was already mentioned here, as I think it's such a basic thing now that we are all aware that our brains and our hearts work in a coordinated way, and some practical advice and steps you can take to live a long and purposeful life. So I think we probably all know a little bit about Alzheimer's disease. There's a lot of different kinds of dementia, and they all have a lot in common, but Alzheimer's disease is the one that we see most frequently in older people. And as of now, it's not a reversible process. It's a disorder that just gets worse over time. And the symptoms of Alzheimer's disease, basically memory loss and inability to learn new things. You may have trouble using objects correctly, like knowing what to do with a fork or a spoon, trouble with naming words and finding words, difficulty doing tasks that maybe you did all your life, confusion about time and place, being oriented to where you are, withdrawing socially, can be changes in mood, loss of initiative, apathy, depression, just a whole constellation of symptoms that are heading towards just kind of losing the essence of your memory and knowledge of yourself and those around you. So this is the kind of thing we don't want to see with aging. You know, those people that have the incredible healthy body, but not the mind. We want everything to be working together. So there are some risk factors that increase the probability of having Alzheimer's with age. And age itself is the biggest one. As people get older, the percentage of people with Alzheimer's increases. Being a carrier of a gene called the ApoE4 gene, which is involved in lipid metabolism. People who have one of those genes from a parent have an increased risk of Alzheimer's. And if you have one from each parent of this particular E4 gene, the risk is even higher. Head trauma, you know, all the fighters and the boxers and the football players, having your head banged around a lot is very bad for your brain. There's some cushioning in there, but it's far from perfect. Lack of physical activity, you know, people who sit too much, like kind of I do at our computers or in front of our TV, this is not a good thing. Family history, knowing if there is Alzheimer's disease in the family. If someone already has some impairment in their mental sharpness and cognitive function. And again, that heart-brain connection, cardiovascular disease increases the risk, as does obesity and diabetes and high blood pressure. All those things that hurt the heart and the brain. So just a brief overview of what we see when we look under the microscope at Alzheimer's disease brains. Inside the brain, we see these misfolded proteins just accumulating, and they sit inside and outside the nerve cell. And the amyloid kind of tends to sit outside surrounding the nerves, and the tau protein on the inside. Now, these proteins can be an indicator that the nerves are not functioning well. But more and more we're understanding they're not the cause of Alzheimer's. They kind of come out of a process that began many years before these proteins even accumulated and were visible under the microscope. So when I do my research, which involves trying to find cures and treatments, we know that we really want to start early, looking at those early changes before things are crumbling, basically. So the treatments that we have now, as I said, there aren't any cures. We have some drugs and medications to offer that maybe can stave off some of the symptoms for about maybe 6 months to a year and a half. The new drugs, these anti-amyloid antibodies, are out there. There's a lot of controversy. I could give a whole talk about that. But some of the side effects of these antibody drugs are brain swelling and bleeding. So they have a lot of issues, and there's a lot of you know, debate and uncertainty in the medical community about what we're going to do with these drugs. But right now, what we want to do is stave off dementia and loss of mental abilities and be proactive with our own hope. And while we do that, maybe we can keep our brain sharp longer as people all over the globe, myself and so many others, are looking for that real cure, that real breakthrough that's going to keep people at home, living their lives and functioning for longer and more meaningful amounts of time. So what can you do to decrease your risk and delay onset? Well, it's that healthy lifestyle. In other words, if you know or don't know your risk of Alzheimer's or of most any other of these diseases of aging, following these guidelines will be so good for you. A balanced, nutritious diet and staying hydrated, regular physical activity like you just did with John. This is so great. It's so essential and wonderful to see. If there's an issue of weight, overweight, obesity, weight control with diet and exercise. If you have diabetes, keep the blood sugar under control. Don't let your blood pressure get out of hand. You won't feel it. It doesn't have symptoms until something catastrophic happens, but prolonged walking around with that high blood pressure is damaging your blood vessels day after day. And of course, tobacco, smoking, it's such a poison. This is something I think we've known for so many years. And I understand that a lot of people have this as, you know, a really difficult addiction to break, but it adds years and healthy years to your life to abstain from smoking. Next is the diet. So everybody talks about the diet. Diet is so much in the literature. It's so much on our minds. We're seeing all these diet drugs and Weight Watchers and all these different things. But I think there's so much information out there. And as I said, there's a lot of research. I can give you a few guidelines, but it's really something that you work out with your doctor, with your dietitian, with your family, with your own ability to cook and prepare meals and your budget. These are just a lot of personal things that go into diet. But some things that we have learned that overall a diet called the Mediterranean Mind diet is just generally good. And the kind of guidelines on that are eat a lot of vegetables and fruits, especially berries, nuts and seeds. Don't eat a lot of meat. Go more for fish than meat if you have a choice. Eat kind of plant-based, rich in fiber, low in those very damaging saturated fats. Keep more unsaturated fats, you know, like olive oil. The refined sugar, that sugar that a lot of us love, and I am one of those people. That refined sugar is just so bad for so much of our bodies. It gloms onto all the other molecules and does a lot of damage. And those processed foods, again, they're so easy, they're so convenient. And I can't say that we could all avoid them, but just keep in mind, if you could eat a food that isn't processed, if you could pick up a fresh fruit or a fresh vegetable or just frozen, but not manufactured or going through processes where sugar and salt and other things and preservatives are added, it's so much better. And we need some grains. Whole grains are best. You know, a lot of the white breads and the things that we took out all of the fiber are not good. It's better if we have the fiber and the nutrients in our grains. I think it's so important to recognize the need to be considerate of the culture of the person eating the food and know that diet is not one size fits all. In our lives, food is such a source of enjoyment and ability to socialize, and the food should appeal to the person eating it. If I give you a plate of incredibly healthy food that turns you off and you can't look at it, I've accomplished nothing. Sorry about that. We're by the hospital, so there's always a lot of noises coming out. Apply specific knowledge of a person's food habits, preferences, and practices. Like you can't just tell someone who's eaten rice all their lives or who is used to certain kinds of breads or, you know, specific candies and treats that they like or whatever, or foods that are whatever kind of thing that they enjoy. Like you can't eat that anymore. It's just not realistic and it's going to hurt the quality of life. But we can adapt traditional recipes to keep the essence of what makes them unique and tasty and maybe change the profile to make them more healthy. That's what I always aim to do. So it's very important to think about your cultures and traditions in healthy eating, and to think about ways that if you're sitting down with a family and some people are watching their intake more than others, that everybody can sit and enjoy the meal. And I think we need more dietitians and nutritionists with diverse backgrounds to help do this and think about this. Again, if you don't like it, you won't eat it. And that's certainly true for me. If you put something in front of me I don't like, I care about health, but I'm not going to eat it. I want to enjoy my food. Exercise. We want to exercise and stay active. If you're older, that shouldn't mean that you don't move. If you have some limits in your ability, you can find a way to move. Again, we have to go with individual needs and capability. We have to consider functional limitations and aim for the moderate intensity 30 minutes, 5 days a week. And again, there's a lot of give and take leeway, but try to get some of that in. Talk to your healthcare provider. Come to sessions like this where people like John will help you. There's lots of videos on YouTube. There's lots of ways to get that help to make sure that you don't harm yourself. We want to do strength training, balance, and low impact. So we don't want to hurt and damage our joints with too much wear and tear. So we want the low impact. We need strength. As we get older, it gets harder to carry the groceries up the stairs. It gets harder to lift and bend and move. And we want to have strength in our muscles, in our arms and legs, in our center, and balance, because falls are more and more of a life-altering and consequential event as you get older. You know, young person falls, they get right up. As we get older, we fall. Did we tear something? Did we break something? Are we going to be in bed for weeks or doing rehab? So we don't want to fall. We want that balance. It's so important. Some practical suggestions for exercise. Again, you try to do things you like. Move your body, dance, do exercise classes, yoga, Pilates, Tai Chi, stretching, bicycling, things that you like that you could do indoors or outdoors. If your weather permits and you could be outdoors, I think it's so pleasant and wonderful to try to be exercising outside. Try to stay on flat surfaces, free of tripping hazards. Again, we don't want to fall. Get really good footwear. Get footwear that is stabilizing and comfortable. And again, those activities you enjoy, dancing, joyous things, things that make you feel good. And you could do it alone or in a group. And of course, walking counts. Walk, walk, walk. Do different things, mix it up, and make sure that you are getting that exercise in at least some days a week. Avoid head injury. Okay, I mentioned this before. Concussions are damaging, and the more times a person has a concussion or gets blows to the head, the worse it is. When you are doing activities where you're risking head trauma, wear a helmet, drive safely, of course. Use soft surfaces for sports, and there are concussion protocols. So everything you could do to protect your head and treat it like the special, important encasement that's an enclosure for your brain. Treat it as the important thing that it is, and try not to bang it around. So how do you keep your brain keen and clear? Well, you know, it's something that we think of called cognitive reserve that we want to maintain. And that's like filling your gas tank, keeping your brain full of knowledge, thought, action, just like I talked about, you know, exercising your body. Do the same for your brain. You want to cushion it against deterioration by having as much of this reserve built up as you can, because it keeps the brain connections all working efficiently. It keeps you flexible. You know, as life goes on, we face challenges. When you're young, there's lots of challenges. As you get older, there's challenges. Life comes at you like whack-a-mole, right? Every minute, there's a new thing that you have to face in life. And if you could be flexible and keep yourself on the ball with your thought processes, that is going to help you to keep your cognitive reserve and keep your brain working. Use it productively. Think, absorb ideas, be active in life. Even if you've retired, don't retire from doing things. Don't retire from being a useful person who's contributing to the world. Lifelong learning. We really can. We can learn at any time in our lives. Try a new language, take classes, do crafting, hobbies, puzzles, read, play a musical instrument. I mean, try things you never tried before. I am not at all talented in art, but my daughter makes me draw. She wants me to draw so that I can just have practice at something that I'm not comfortable with. I don't play a musical instrument very well, but if I sit down with a keyboard, I'll at least try to strum out a little tune. Like, you don't have to be great at it, but try it. A few weeks ago, we did this like 1,000-piece jigsaw puzzle. And I said, I can't do this. And I was like, all right, I can put one corner in, I can do little by little. And it was something different from what I do every day. And then when we got the puzzle all together, it was so fun to see the whole thing. So you could surprise yourself and do things you never did and end up liking it. Even things like cooking, like I'm not much of a cook, but I watch the cooking shows and I learn about cooking and I say, oh, I could try this or I could try that. And maybe it'll fail, but you tried. So more things that I want to talk about that you could think about doing. Of course, the fun things of social engagement with family and friends, and just meetings like this today where people are getting together online or in person, get out there and get together with people. Manage stress and depression. There's a lot of evidence that when you are stressed and depressed, it's really bad for your brain. All the stress hormones and all the relentless attack on your brain of being sad all the time and unhappy and stressed is very bad for your brain. And here's one that I have to talk about. So especially during COVID, and also because we are all so good about our putting on SPF and putting on sunscreen, so many people are vitamin D deficient. Now, maybe not as much in Atlanta as here in New York, but we have huge numbers of people who just don't have any vitamin D or have very low vitamin D. And I'll tell you, I myself was one of those people. I checked my vitamin D. I thought it would be good, and it was only 10, and it should be at least 30. And you know what I found out? I love to eat yogurt. I eat lots of yogurt, and I thought the yogurt had vitamin D, but you have to read the yogurt label because some yogurts have vitamin D and some yogurts don't have any. So don't assume that your yogurt has vitamin D. The other thing about vitamin D is that if you are vegetarian or vegan, especially vegan, it's really hard to get vitamin D. About the only food that you will have with vitamin D is mushrooms. So keep in mind that plants are great for a lot of things, but for vitamin D, you need sunlight or you need a supplement or you need some foods that have it. And sleep. As you get older, I think it gets harder and harder to get the sleep quality. And so you need to do things that help you get a good night's sleep. Blackout curtains, really good, comfortable pillows, trying to do relaxing things before bed. I mean, there's a lot of things that we are told that may help, but you have to, again, figure out for yourself and with your healthcare provider, how do you get the best sleep that you can? I think it was like in The Sound of Music that there's a quote from one of the songs, strength lies in nights of peaceful slumber. And I think that's really true. So hopefully we can all try to get that good sleep. I want to go back to the heart and blood vessels, keeping the brain nourished. Your brain has to have energy to work. It has to have glucose and oxygen. And where does it get it? From the blood supply. If your blood flow to your brain is reduced because you have vascular disease in the brain and the blood vessels aren't so good, or your heart isn't pumping so well, then it may not deliver that blood to the brain and you will have impaired thinking. And that is something that we can avoid by taking good care of our heart health. So what's good for the heart is good for the brain, and you get double benefits, like a double coupon. The healthy brain needs a good blood supply. And again, it's like the same things I just went over. Exercise, diet, control blood pressure, and don't smoke. So you're giving yourself, again, a double dose of health by doing those things. And what is next? Okay, so I want to just say this. If everybody could do all the things we just discussed, and we could give you a pill that would have the same effect as following all the things that we just went over, that pill would be worth billions of dollars. So I've just given you information that could be worth billions of dollars if I could market it. But I don't need to market it because you can do it yourselves. We need targeted dementia prevention initiatives. We need to get out in the communities and get to people and talk to them about this and make sure people understand how important it is to keep the brain healthy. And for me, it's bench to bedside. It's what am I learning about the science of the brain in my state-of-the-art laboratory that I'm so privileged to run, where I can work with incredible, wonderful people to try to make the breakthroughs, go from there to help people. And every day my team, and like I said, teams around the world are working to find new treatments to prevent dementia. And I have to say, I have a lot of faith in that. I think we are going to have those breakthroughs. So that's why I say, keep your brain healthy as long as you can. And we're going to work on our end. We're making that promise to you to try to find the treatments and the medications to be there to support you and help you every day to stay healthy and sharp and have a brain that's working and giving you just wonderful quality in your life. I want to say my thanks and my thoughts to the memory of Linda German, the memory of Malushka and Shalom Gorelik. I want to thank the Herb and Evelyn Abrams Family Amyloid Research Fund for supporting the work that we do. I want to thank Ms. Dolores McCormick, Mr. Edmonds Bafford, and Mr. Robert Boucher, again, for incredible support, and the Alzheimer's Foundation of America for their support. And thank you to all that help us do this work, because it doesn't happen without support. I want to thank you all for listening, and thank you for Dr. Parker and to everybody, and have a wonderful day, a wonderful spring. And if you need to get in touch with me in any way, Dr. Parker can help to do that. And thank you so much for your attention. It was just a pleasure.
Thank you, Dr. Reiss. She's said thank you, and she's given us a whole lot of information, some of which we've heard before. But if you've not been to any of our BrainTalk live sessions or any of our other sessions, you may not have heard this information. So one of the things that we do talk about, and we talk about it consistently, is that before disease sets in, you have to do certain things to prevent these things from happening. Like pregnancy, you can do something to keep pregnancy from happening. You can do things to prevent the likelihood of your developing dementia, despite what your genetics may or may not be. I'm answering some questions in the chat. It's sort of like, well, how much is a genetics test? And, you can't just take a genetics test to determine whether or not you're going to be somebody who develops Alzheimer's. A lot of people who carry the gene never develop the symptoms and are never impaired. I've got questions in here like, how much vitamin D is enough? Well, you can measure that. Your doctor can order laboratories that measure the amount of vitamin D in your system. And if your level is so deficient that you need a supplement, we can write a prescription for a prescribed dose of vitamin D. In the interim, if you're worried about it, you can take an over-the-counter vitamin D supplement, but be wary of taking too many supplements indiscriminately without knowledge of whether or not you actually have a deficiency. And so that's what I put in the chat. So Dr. Reiss, if you wouldn't mind, there are some chat questions in here that you may want to answer live. I'm going to start with the first one here. I don't have a problem falling asleep, but staying asleep is very problematic. What can we do to help this person? How would you advise this person?
Well, I don't know what to say, because I think that is such a common problem, that people wake up in the night, and there is a lot of debate about whether you should get up and not stay in your bed, because being in your bed can make you kind of programmed, like, to be associating your bed with lying there and not sleeping. So some people think you should get up for a bit. Other people think you should just try to relax, to say to yourself, I am resting, even if I'm not asleep. So I think, I mean, I would always tell you if I knew an answer. I think that drugs are not a good answer. And, it's interesting because some of the drugs that people use, like Benadryl to sleep, there's some thoughts that those drugs can aggravate Alzheimer's disease. because of the way they affect some of the neurotransmitters. So I'll tell you, I do this a lot myself, to be honest. And when I'm up in the night, a lot of times I come up with ideas. I don't know why, like maybe when you're relaxing, the ideas come and then I write them down. And then I try to go back to sleep with like a little soft music or a little soft radio or something that maybe is on for half hour and goes off. But again, those are my experiences. I think it's a tough one. And I think some of it is part of aging that does happen.
And just to piggyback onto what Dr. Reiss has said, when you are questioning these things, and I appreciate your giving us these questions, but I really want to encourage you to ask your own doctor these questions, simply because some people get up in the middle of the night and have difficulty with sleep because they have sleep apnea and other sleep disorders. And if you have a diagnosis of those things, there is a medical treatment for them. So Dr. Reiss, I know your area of research has to do with inflammation, and there's a question in the chat about inflammation and food and how do they fit together? What are the best foods or supplements to reduce inflammation in the body? And I think that when people who aren't physicians hear that, they hear something a little different from what you and I might think of. So neuroinflammation in the brain is a little different from inflammatory diseases like rheumatoid arthritis, or is it?
Well, it is different, and we really have trouble dealing with inflammation in the brain because of the blood-brain barrier. It's really a separate entity of its own that's not connected to a lot of other parts of our system. But the total inflammation of the body is increased when we have some of these medical conditions that you were just describing, the rheumatoid arthritis and other inflammatory activity. Obesity increases inflammation, and diets that are, again, high in all those things that we were talking about, like the saturated fats and lots of sugar, is inflammatory. So when we talk about a diet that is low inflammatory, we're back to kind of that Mediterranean diet. I don't think there's any one supplement that's great, because I think you're better to eat holistically. Everything works better in food than in a pill. That's what I would say in general. You try to eat foods that have good nutrition in them, and your body processes that much better.
And on that note, what Dr. Reiss is saying, just in case, just to recap for everybody, things that are inflammatory are things that you should avoid. And some of those things that she's advocating that we avoid are things that are processed, i.e. things that are not in their natural form. So packaged things like cookies. If you have a disease state that has a lot of inflammation associated with it, rheumatoid arthritis is one, but diabetes and obesity are also associated with systemic inflammation. So if you have those kinds of conditions, you have to work on them as well. And nutrition, appropriate nutrition, is one of those things that she's talking to us about. So when we talk about sugar, I think we're pretty clear on what kind of sugars we should avoid and which ones are acceptable. The more natural sugars like honey might be a better solution than some of the other things. Maybe maple syrup as opposed to the white granulated Domino sugar. So here's another question for you, Dr. Reiss. It says, an 80-year-old male with severe white matter disease, is he at high risk for Alzheimer's? And I think that people need to understand white matter disease in the brain and inflammation. How are they different or the same?
Well, I think that you can't use the scans to know the person. If you see a lot of white matter disease, but that person is functioning and doing well and 80 years old, I think that you just encourage them to live a healthy lifestyle. Like, I wouldn't put them through, a lot of rigorous testing to find out things that may not be relevant to their everyday life. So I'm not a big on over exploring in older people when things are good in terms of the brain, because what we have to offer is so limited. And I also feel it's very important to enjoy your quality of life and not sit around worrying. I see too many people do that, kind of stressing over their mental acuity when they're really doing fine and worrying about things that maybe they could better spend their time like enjoying life and living a healthy lifestyle. So again, there's so many studies that you could find amyloid in people's brains on scans and they're fine. So we have to always make the correlation to real life and not just an image on you know, that a radiologist sees.
A brain image or even a genetics test. Somebody asked about how much do genetics tests cost. And a genetics test isolated aside and apart from what's clinically going on is really not helpful, which is why most primary care doctors aren't ordering genetic tests willy-nilly. So can you comment on the use of cannabis or marijuana, CBD oil, CBD pills? And is that something that older adults should incorporate in their regimen for anti-aging? There's a
Well, I
question.
certainly don't think so. I'm very against that, to be honest, because we have no data except the little bit of data that we do have is not positive. I mean, I think that the integrity of your brain is so important, treating it with respect and not interfering in the basic functioning of the brain. And I mean, I think we're going to have data in the future now because we have so many people using these things. But I also worry about falls. I worry about, you know, what happens when people use these things and they become sedated, especially, you know, with THC, and they fall, or they, you know, there's also weight gain associated with that. I think it also affects sometimes the hormones. So I have no real positives on that. That's my instincts at this point, because we're waiting for more data.
Okay, so everybody, just so that I recap this and make sure that we're clear, there are a lot of vendors out here marketing products that have cannabis in them, cannabis oil, cannabis gummies as a treatment for all kinds of things, even inflammation. And what Dr. Reiss is saying is that there's really not enough evidence about how effective or not effective those things are. But what I need you to also appreciate is the formulations and the mechanisms through which the cannabis is put. They're not all the same. They're not regulated. You get a dose of amoxicillin at the pharmacy. We know how that's been processed. We know how that's been made, and we know what's in it. When you go to a CBD store, you don't know how much cannabis you're getting, how much you're not getting, or what it's mixed with. So it's really, really, really important to take care to understand where you're getting whatever it is you're consuming, to know the sources. Now there's a question about Prevagen as a multivitamin. It's been advertised. So this is one of those supplements, Dr. Reiss. Can you talk to us a little bit more? We refute this all the time, but
yeah, this is just snake oil. This is just making a fortune for the company, and there's no good data. I think they took one trumped up study that they managed to publish or something to make this as if it works, and it's a waste of your money, honestly. I know, I see it's on TV. Well, you know, because they don't have to regulate it if they call it a whatever, a nutritional supplement or something. If it's not a pharmaceutical, this is not worthwhile. And the other one is that balance of nature is everywhere. Okay, balance of nature. No, eat the food. This is not food. They make capsules and try to tell you that's replacing fruits and vegetables. Just no.
Okay, thank you, Dr. Reiss. I say that all the time, and we say that all the time. And again, if you feel you are missing some particular nutrient or some particular vitamin, providers, medical doctors can measure those levels. We can measure your vitamin D level. We can measure your vitamin B as in boy level. And if you need supplementation, we can give you a prescribed treatment for those particular deficiencies. If you're low on magnesium, we can fix that. If you are a hypertensive or a cardiovascular patient and you're taking a water pill or a diuretic, that's getting rid of lots of potassium. It's getting rid of lots of magnesium, which is why every 3 months you should be going back to your doctor to get those electrolytes checked. And where there are deficiencies in those electrolytes, we give you a prescription to replace them. You're taking a medication that you need to relieve a particular symptom and make a disease process better, but just because it's doing that doesn't mean that other things don't occur, which is why it's important to see your doctor regularly if you are on prescribed medications and supplements. So yes, potassium is a supplement, magnesium is a supplement, vitamin B is in boy, and vitamin D are supplements, but you shouldn't be taking them if you don't need them. So I think I put that in there in the chat about vitamin D's being something that you can that can be measured and we can be prescribed. And I love this. Dr. Reiss says, eat the food, eat the food. You don't know what food to eat and you want to make sure that it's okay with you. Make an appointment with a dietitian. I didn't say nutritionist, and although it's important to see a nutritionist, but I learned that there are registered dietitians that work in our hospitals that are responsible for giving us the right kind of diet for our particular condition. If you're a person who has chronic kidney failure or renal failure and you're on dialysis, there are certain foods that you can eat, certain foods that you should eat less of. But the person who can tell you that is not the person selling you Prevagen on television, but a registered dietitian. So you can make an appointment to see a dietitian to learn what you need to eat and have that person work with you to manage and adjust your diet so that you're eating the things that you should be eating that go along with making whatever your disease process better. And that includes things like congestive heart failure. So you should see a dietitian. Maybe you're not interested in a Mediterranean diet. Maybe you're from the Southeast Asian country. Maybe you're from the Pacific Islands. You know, maybe you're from Africa. And that's your origin, your cultural or ancestral origin. So you eat foods common to that group, as she's talked about a little bit earlier. And maybe working with the dietitian can kind of help make the diet that's associated with your ethnicity and your culture less inflammatory. Would that be the better word, Allison?
Sure.
Less inflammatory.
Just like, yeah,
adjusting your diet so that you're less likely to be bothered by inflammation, consume the wrong kinds of fats, so you put yourself at risk for cardiovascular disease. So there's all kinds of stuff that you could do. Okay, I'm going to give you this question, Allison. It says, what are the pros and cons of taking donepezil? And the brand name for donepezil for everybody else is Aricept. Why do we give people Aricept?
So what Aricept does is it helps your brain to squeeze out a little more connection for a little while, because it inhibits the breakdown of one of those transmitters. So it's like you're going to squeeze a little more water out of the rock kind of thing, like you can get a little more juice for the brain for a little while, and then it doesn't really work after that. It's just a little bit of help, and the key for that is to see if it helps. So if someone's taking Aricept and they are doing better, then that's great. We should let them take it, and maybe those patients will do better for a while. But if they have bad side effects from it, they don't feel well on it, they don't like it, it's not helping, it's not going to hurt to stop it. I always say that you, of course, talk to your doctor, your healthcare provider before you would make any changes, but it's only helps if you see that it's really helping, if you observe that it's helping, because it's only at that level that it's really useful. And it can help with Alzheimer's or Lewy body dementia, but in the frontotemporal dementia, like Bruce Willis and Wendy Williams, it can make that worse. So you have to know the diagnosis and make sure you're giving it to the right patient. So it has to be made with a very good judgment of whether to try it.
On that note, Dr. Reiss, you are located in New York at New York University, and we're here in Georgia at Emory University. We have listeners from all over the country. Are there memory centers that you would direct people to living in the Northeast?
Well, you know, we have the Alzheimer's Foundation of America, and they really are so full of background and knowledge to help. Like they have a helpline that you could call. They have people that are so well connected in this field to give referrals and references. And then, you know, with my network, which spans Long Island and New York, I, you know some of the wonderful people here who help with things that, you know, we have comprehensive groups that work together to give the best quality of life and the best assistance. But right here is really the Alzheimer's Foundation is just an incredible source of knowledge and information, all given freely.
Okay, I think somebody on my team is trying to get the Alzheimer's there it is. There's a website listing for the Alzheimer's Foundation of America. HTTPS. Yeah, go ahead.
Josie's on. Can you give us the 800 number, Josie? If you're still on.
She might not have heard us, so we're gonna have to dig it up, but look up the Alzheimer's oh, there she is. Alzheimer's Foundation of America helpline, 866-232-8484. 866-232-8484. And that's a way that you can identify, that organization will help you identify a provider or a memory center in your area where you can get help for yourself or your family member who may be affected with Alzheimer's or related dementia, as well as training for caregivers and health professionals. So with this, it's 2:57. I want to thank you, Dr. Allison Reiss. We serve on the Alzheimer's Foundation of America board, and I'm so glad you agreed to talk to us. You had a rapt audience. I mean, they were on it. We had over 223 people listening to you, and in the last 2 minutes, we got down to 219. So thank you, Dr. Reiss.